So today I'm going to talk to you a little bit more about balance and the balance system. So pretty much in everybody, we have three systems that all work together so that we all have good balance no matter what age you are. So we have our balance organ, which is our vestibular system in our inner ear. We have our leg strength. And then we also have our visual component, which we rely heavily on when something else is not working properly. So when we talk about balance, when it comes to the older population, we're talking like about 55 and older, things are a little bit more complicated because there's a lot of issues that can arise that can affect your balance. So the first thing I would have to say of common issues with balance is number one, medication use. So as we get older and have some other issues that arise that are, coming from different issues as far as cardiac and visual issues, medications can be playing a big role with that. So if you're on multiple medications for any kind of heart problem, the biggest side effect is orthostatic hypotension, which is making someone lightheaded because we're trying to decrease your blood pressure, but when you move quickly or change position quickly enough, your blood pressure then decreases faster, you become lightheaded, and then you get up from bed in the morning and then you would have a fall. And that seems to be pretty common, especially older patients. We're talking like in their 70s and 80s. Most of their falls occur in the home, and a lot of that has to do with medication management. So that's the first thing. The second thing is regular musculoskeletal issues such as osteoarthritis, tendinitis, bursitis, any of those things that cause pain in the legs, where whether you have surgery or not, any kind of compromising effect on your muscle strength will affect your balance, because that is one of the three different areas that need to be working properly in order to have good balance. So if you just have osteoarthritis and you're having for instance, some knee pain or hip pain because of that, your muscles tend to get weaker, and so there's no stability for those joints, so you're at a bigger risk for losing your balance and then hence maybe possibly falling. Also, after an injury or surgery such as a total knee replacement or a total hip replacement or any kind of surgery, if you break your ankle, that kind of thing, automatically part of the healing process is active inflammation of the area, and then a lot of your muscles around the areas will kind of shut down. So when you don't have that strength, you will be trying to rely more heavily on the opposite leg, more on your back muscles, but it will cause you at an increased risk of having issues with balance because those muscles are not functioning properly like they should be. The other thing I'd like to talk about is a little bit more about diabetes. Diabetes is a pretty common condition, especially like type 2, which is adult onset diabetes. And what happens with a diabetic issue is that you start having something called peripheral neuropathy, and that always starts distally and works its way proximally. So we're talking your feet, and what happens is you start to lose that sensation in your feet. So when you're walking, especially outside, or you're not wearing proper shoe wear and you're walking your home even, you don't have that sensation there in the bottom of your feet to determine what is under your feet. So you might step on something, or you might not feel that there is an issue with the concrete outside, and you just more will likely stumble and lose your balance and possibly have a fall. So that's a pretty significant issue as you age, and all these other complications that arise that could affect your balance. So for fall prevention for somebody in that group population, you want to really get to learn the side effects of your medications. Anything that has a side effect of orthostatic hypotension, or if it says may make you dizziness, the more of those medications that you're on, the increased risk you have for having balance issues. So try to be on top of it. And one of the biggest things is when you wake up in the morning, or if you're getting out of a chair, you just kind of want to take your time a little bit more and go a little bit slower, because then you're at a lower risk of falling because you're taking your time. The other thing with surgeries, loss of strength, like I said, leads to issues with balance. So you want to make sure that you're properly getting exercises that pertain to your injury, and that you're strengthening the right things, because once those joints or injuries within different bones or joints or ligaments or tendons, once the muscles are strong enough, your balance will then start to come back. And with those things, it's very important to know that the more issues you have, whether it's surgical or not surgical, there may be the need of an assisted device, and someone like a physical therapist would be the perfect person to be able to assess that for you and let you know, so that you can prevent falling in the home or outside the home. The other thing is with diabetes, with the decreased sensation in the feet, being able to check your sensation a lot. You want to make sure that you are looking at the bottom of your feet before you're putting shoes on, looking at the bottom of your feet before you're taking your shoes off, making sure there's nothing stuck there that might get inside the skin there and cause pain. And because you have decreased sensation, you're not necessarily going to feel that pain. So it's really important to check your feet. And not wear socks. You want to wear socks. You want something cushioning between the sole of your foot and the shoe, so that's pretty important. The other thing is with vision. As we age, a lot of people have visual difficulties, whether it's cataracts, glaucoma, and even macular degeneration. So because your eyes are a huge part of the balance system, when there's issues with the vision, you're going to rely more on your strength and more on your inner ear organ to compensate for balance. So if you're not taking care of your vision, then you're definitely going to have more issues, and that would probably come up more in the dark. So when you're at home and you have to go to the bathroom in the middle of the night and you have visual issues, it's really important that you have night lights in the home that kind of guide you to where the bathroom is or where the stairs are. Those are all very common potential places that people kind of lose their balance and fall and have injuries. So with physical therapy, is a great option for patients that have issues with musculoskeletal injuries. Like I said, whether it's non-surgical or surgical, we're there to increase the strength in your legs, which then increases balance, but we also give balance exercises, which kind of challenges all the systems of your balance system and allows everything to kind of work properly again so that you can compensate if something is not working to its fullest potential. We can teach you all those things. We can educate you on home modifications, so anything in your home that may come up as kind of like a red flag, so that we can tell you what to do in order to prevent a fall at home. And also assistive device use, like I said before. So if we're noticing that some of our patients are having some balance issues, and we're seeing that in the clinic and you're walking, you're having a really hard time, we may make suggestions to use a cane or a walker, and that doesn't necessarily mean it's permanent. It's just something in the temporary scheme of things that will help you to get better balance and a better handle until you're a little bit stronger. So those are the things that have to do with more of the 55 and older population. The younger population, it's a little bit different as far as balance is concerned. The biggest thing are just sports injuries. We see a lot of high schoolers, middle schoolers with sports injuries, and lots of kids are participating in sports year-round these days. So the thing is, when you have an injury from playing sports, whether it's an ankle sprain or like a tear in your ACL, not only are your muscles around the joint weakened after that because you kind of lean off to the other side or you're compensating for that injury. The other issue is that besides the decreased strength, if you have any kind of ligament issues, you're losing that stability of the joint because the ligaments attach from bone to bone. So for instance, if you have an ankle sprain and you roll your foot inwards, let's just say, those ligaments kind of get a little overstretched, and especially if you're more prone to ankle sprains, the more you sprain something or overstretch some ligaments and tendons, the more you're going to be at risk for having further injuries. So we want to assess that as soon as possible so that you can have the correct injury management to prevent further injuries. We want to properly address the weaknesses of the core, and that is a very big thing these days, especially with young girl athletes. So, it's one thing if you're, a swimmer and you're really working on those shoulders, or you're a gymnast and you just are working a lot of power in your legs. But the thing is if you don't have what we call proximal stability, which is your core, which is your abs, your pelvis, your hips, if you don't have that, then anything away from the core can be easily affected and injured. Your core is your stable area of your body, and anything that kind of stems from that, you're more at risk for injury if that's not strong. So with physical therapy, we treat a lot of sports injuries, whether you're in middle school or high school or doing some recreational activities. We'll be able to educate you on injury prevention. We'll be able to give you that education on your injury that you're having and make sure that you're able to return to sport and properly progress your exercises to prevent the re-injury. That's a huge thing. A lot of times people get a sprain and then they kind of rest for a few days and it feels better so that they return to the sport, but then the problem is they don't realize how weak they've become because they haven't really done the activity in a while, and then you're more at risk for re-injury. So if you have any kind of injury, it's usually beneficial to seek out some kind of professional help like a physical therapist, because at least we can guide you through the process and educate you correctly on what exercises are best for you. So give us a call or click the link below if you would like some more information or an assessment of an injury, whether you're in the 55 and older population or a younger population and you're wanting to learn more about balance.